everywhere I go talking about how do you reduce costs, chamber reform, and things like that, everybody says to me, well, so who should we look to? Who's a model to do something better? And everywhere I go, I say, look at Maine. You should look at what Maine is doing. And people go, Maine? Sorry. Not California, not Minnesota, Maine. And I say Maine. And I mean that because what I've seen happening in Maine isn't happening anyplace else.
So here's my take on where we stand today. First of all, we have a common set of objectives. We want to improve the quality of care in Maine, and we want to reduce the cost. We have a common, shared, and transparent data source, the Coalition's database. We have strong analytic capacity within the Coalition and within all of our members. We have a vehicle or forum to drive change, this multi-stakeholder coalition. And I think the work of the healthcare cost work group is strong evidence of that multi-stakeholder approach and what can be achieved. We have a list of opportunities to reduce costs that we're going to talk about today. We have a supportive and committed foundation board and staff to make this happen. I think we have all the ingredients here to make this happen. The one thing we don't have is a lot of time. We need to do it now.
And so what gets me up in the morning is how do we make all of that come together? How do we figure out ways to provide effective, satisfying, and lower cost care for the people that we serve?
The other thing to notice, and this really gets to the crux of what we're trying to do, if you start talking about reducing inpatient costs, you immediately see you're talking about working on about 20% of the total PMPM, okay? And so the overall difference, if you reduce inpatient costs by some measure, say 10%, you're only reducing 10% of 20% of the total PMPM. That's the kind of thing we really want to be clear about, because people talk about doing a whole lot of things, and then what is the overall impact on the total cost of taking care of the population? And although we've talked about utilization, price, and so forth, there's significant complexity around some of these interventions and whether they are in fact feasible. You start talking about price, infrastructure, the issues are very, very different as you go across these different interventions. And I can tell you, looking at the data, and especially when we looked at 5 years of data from OnPoint into the Coalition database, and as we went by employer and looked at what was driving trend, it invariably was growth in outpatient total costs.
There's actually 3 things that you have here that virtually nobody in the country has, particularly all of them coming together. One is having all the stakeholders in the community actually coming together to talk. The purchasers, the providers, the docs, the hospitals, the health plans, and the consumers. What I find is in a lot of places, people don't even appreciate why that's important. And the reason why it's important is because if you don't have that, the natural tendency is for every stakeholder to go off and work on their own, and what they will come up with is a win-lose solution. What can I do that will benefit me that may hurt others? And when you bring all the stakeholders together, you actually have the opportunity to get win-win solutions. Because there's actually ways to make this healthcare stuff get fixed in a way that will benefit everybody. Second thing that you have is data. And it is a desperate need in most places in the country. People don't have information to be able to drive those discussions. And so when people do get in the room, they end up kind of talking about broad theoretical things and myths and what I believe is the case. And when you have data, you actually can talk about the actual facts and what's really driving things. And the third thing that you have is actually an analytical staff that can actually do something with that data. There is no place in the country I have seen anywhere that was able to seize data like you just saw data from Microsoft. You'll see some stuff with these kind of vague actuarial categories. Oh, you have high surgery rates here. Why? What kind? What's driving it? Can't tell you because the folks who do that data don't know how to analyze it. And you have a huge asset here in terms of having data and having the analytical capacity to support it.
So,
The proposition is that we'll move toward global payments and budgets for coordinated systems of care and shared risk, with the clear understanding that the market will continue to use other levers, such as tiering, in the absence of progress. Does anyone want to make a comment about that proposition?
Get rid of all the things that are holding us back, because from the provider perspective, if we're gonna manage that patient, we can't be saying, well, no, you're gonna have your MRI over here because your plan is tiering and it's cheaper there. We've gotta be able to manage those patients as a whole. So we've gotta get rid of those outside things, all those things that were on the left side.
And it's really an employer perspective. We're tired of paying this and we want a data source.
Yeah, but it's the simple statement of how many times are we going to pay different groups of people to create the same thing?
Okay, so
That there are a lot of people in the community mental health and behavioral health sector that are not thinking in these terms. And they really are not kind of conversant with where the market is going. That's my impression anyway. I just want to make sure we're thinking about a comprehensive provider sort of progress moving forward that doesn't leave a large sector out that we'll be sorry is left out later down the line.
how many of you strongly agree? Green. And now keep those up. And if you are sort of on the fence but willing to live with it, put yellow up. Keep the greens up. Okay, anyone disagree? Can't live with the proposition? Does everyone have a card up? Everyone has to have a card up. But you only are using yellows? Okay, it looks to me, and would you all agree that we have strong consensus around this proposition? All right, good. We survived it. That was an excellent stretching exercise. Let's move to...
thank you everyone for coming and say that lest you think all of this conversation, these slides, these whiteboards are going to be thrown into a black hole. All of this is going to go back to the foundation board, give us a chance to regroup, discuss what we heard today, and then come back probably to this group at some later date, I would suspect. I guess that remains to be discussed. But the important thing is that we're going to take all this information back and regroup and figure out where to go from here. So I want to make that point. Again, thank you so much. Stop raining. I'll take that as a positive sign that this is going to work. And really, your commitment is so important. Your support of the coalition is so important. So thank you all.